How can advanced diagnostics prevent GERD relapse? Imagine trying to fix a leak in your house without knowing where the water is coming from. That's what managing gastroesophageal reflux disease can feel like without the right tools. Advanced diagnostics are like the leak detectors that help find the exact source of the problem. GERD is a long-term condition where stomach acid flows back into the esophagus, causing heartburn and sometimes damage. Even after treatment, symptoms can come back, which is called a relapse. Preventing this relapse is all about understanding what's really happening inside your body. Not all acid reflux is the same. Some people have visible damage to the esophagus, while others may have no visible signs but still feel symptoms. That's why a one-size-fits-all approach doesn't work well. Advanced diagnostics help doctors see what's going on at a detailed level. The first step usually involves a thorough review of your symptoms and medical history. If your symptoms stick around despite taking medications like proton pump inhibitors, or if there are warning signs like trouble swallowing or weight loss, more detailed tests are needed. One common test is an upper endoscopy. This procedure involves inserting a thin, flexible tube with a camera into your esophagus, stomach, and upper small intestine. It can reveal erosions, strictures, or Barrett's esophagus, which is a precancerous change. Sometimes, even if the endoscopy looks normal, your symptoms persist. That's when other tests come into play. Esophageal manometry measures how well your esophagus muscles work, especially the lower esophageal sphincter, which acts as a valve to keep acid out. High-resolution manometry provides a detailed picture of muscle function and can identify motility issues that might cause or worsen reflux. Reflux monitoring, which tracks acid levels over 24 to 48 hours, helps determine how often and how long acid is present in your esophagus. This test can be done while you're on or off medication. The Layan consensus provides specific guidelines for interpreting these results, like if acid is present more than 6% of the time, it confirms GERD. Impedance pH monitoring is another advanced tool that detects both acidic and non-acidic reflux. This is especially useful if your symptoms don't improve with standard treatments. Newer measurements like mean nocturnal baseline impedance and the post-reflux swallow-induced peristaltic wave index help assess how well your esophagus clears reflux and how sensitive it is to acid. By combining these tests, your doctor can pinpoint whether your symptoms are due to true GERD, other esophageal issues, or functional heartburn, where symptoms aren't caused by acid. This precision allows for tailored treatments. For example, if manometry shows weak esophageal muscles, therapies to improve motility might be added. If impedance pH monitoring shows persistent non-acid reflux, different medications or lifestyle changes can be recommended. Early detection of complications is another benefit. Regular monitoring can catch Barrett's esophagus or strictures before they become serious, allowing for timely intervention. For those with a history of these issues, ongoing surveillance becomes part of long-term management. If you notice your symptoms returning, don't just assume it's a temporary setback. Talk to your healthcare provider about advanced testing options. These tests help identify the root cause, so your treatment can be adjusted accordingly. This approach not only controls symptoms better but also reduces the risk of long-term damage and the need for more invasive procedures later. In short, advanced diagnostics are key to preventing GERD relapse because they reveal the specific reasons behind ongoing symptoms. They guide personalized treatment plans and help catch problems early. This means better symptom control, a higher quality of life, and a lower chance of developing serious esophageal conditions over time.